Hello, Rebecca.
Hey. Hello, Mercedes. Happy New Year.
Yeah, exactly. Yeah, we forgot.
No, we haven't actually said that to each other, even though we talk quite often. And Happy New Year to everyone that is joining us on YouTube.
All right, shall we start?
Perfect. Yeah, you're going to dive in with your presentation, I guess, right?
Yes, that is correct. You can
Wonderful.
please.
Oh, and just before we begin, there is a chat box on the side, so please leave any questions there and we'll have a discussion about them at the end. So yeah, please, any questions, big or small, comments, would love to hear them.
All right, you should be able to see the slides now, right? Okay, cool. So we're going to today talk about something, actually a topic that is way overdue. And the title is What Happens to Our Brain After CBT? Why CBT is so important, why CBT is one of the most, or possibly the most widely used psychotherapy method for a wide range of disorders or mental health issues in general. So I would like to I would like to start with greetings to everyone, and thank you again for being with us today. My name is Mercede Erfanian, and in today's session, together with Rebecca Howard, we will explore the transformative effects of CBT, or Cognitive Behavioural Therapy, on the brain. We will delve into some of the changes that take place in the brain after engaging in CBT. I want you to remind you that we are not going to talk about everything that CBT does, but I'm going to just make a few examples of what CBT can potentially do to the brain. Following our discussion, Rebecca will share her insights based on observations within clinical groups she collaborates with. And I would like to emphasize that these webinars are part of a monthly series organized by Hashir International Institute. We appreciate your continued engagement and encourage you to stay tuned for upcoming sessions where we will continue to explore various topics related to misophonia. Towards the end of today's session, we will reserve a few minutes for any questions you may have. So again, I'd like to start this webinar with the consensus definition of misophonia. And according to this definition, misophonia is characterized as a disorder marked by reduced tolerance to specific sounds or stimuli associated with such sounds. Since we are going to be talking about CBT today and how it changes the brain, it is first important to know that there are several ways, strategies, or even treatments to change behaviors, feelings, emotions, attitudes, thoughts, or even neurophysiological responses, depending on the issue and disorder. And of course, depending on the gender of the person and also the age group that they fall in, and also the mental status in general. This changing or modification can be easy or difficult. There are more invasive methods such as neurosurgery and ECT, or electroconvulsive therapy. Some people know it as shock therapy, or DBS, or deep brain stimulation, in which the experts or the doctor puts an electrode deep in the patient's brain. And it can also be considered as neurosurgery methods, as well as less invasive approaches like neurofeedback, medications, TMS, or transcranial magnetic stimulation, and psychotherapy, also many more. So, what is CBT? CBT is a form of psychotherapy that has been demonstrated to be effective for a wide range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness. The CBT also is very effective for just changing a single behavior. Imagine you smoke a cigarette, you want to quit smoking, or you bite your nails, you want to quit biting nails, and you do CBT. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as, in some cases, actually more effective than other forms of psychological therapy or psychiatric medications. It is crucial to highlight that progress in CBT has arisen from a combination of research findings and practical applications in clinical settings. Unlike many other psychological treatments, CBT stands out as an approach supported by substantial scientific evidence, demonstrating that the developed methods effectively bring about positive change. So, CBT is based on several core principles that I'm going to give you a very general overview of what they are. Psychological problems are based in part on faulty or unhelpful ways of thinking. Also, psychological problems are based in part on learned patterns of unhelpful behavior. So, people suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more effective in their lives. But before talking about the brain basis of CBT and how CBT affects our brain, I should explain a few terms here that are very important. One is long-term potentiation, and the other is long-term depression, which are important in creating, reforming, and extinction of behavior. We know that the neurons that wire together fire together. This is a very common term in neuroscience. So when we engage in certain mental activity or learning process or a certain behavior over and over again, the neurons in that specific pathway get a lot of exercise. Over time, these neurons start to build a stronger connection. It's like they become better at transmitting information to each other. As a result, the information travels more easily and quickly along this pathway. It is as if the neurons actually have developed a kind of muscle memory for this particular task, knowledge, or behavior. So imagine if a person, let me actually make this example a little bit further once I explain these two terms. So the term long-term in long-term potentiation means that this strengthening of connections can last for a while. It is not just a temporary boost. It is lasting change that contributes to your ability to change an attitude, reshape an emotion, and modify a behavior. So when a certain pathway in your brain are not used very often, again, go back to that example of smoking a cigarette, you stop smoking a cigarette. So this pathway undergoes long-term depression. It is like the brain saying, these pathways aren't getting much traffic, so let's make them a bit weaker or trim them down a bit. So this process helps the brain becoming more efficient by getting rid of connections that aren't frequently used. So if long-term potentiation is like a strengthening a well-trodden path in the garden, long-term depression is like gently clearing away some of the less used trails. It is the brain's way of fine-tuning and optimizing its network to make sure it's working at its best. Let me make an example here, as I promised earlier. So picture someone who starts smoking regularly. The nicotine in cigarettes make the brain release a chemical called dopamine, which gives a obviously good feeling. Over time, as the person keeps smoking and feeling good, the brain gets used to it. It's like the brain's connection related to smoking becomes stronger and stronger, making it more efficient and powerful, similar to how a well-used path becomes clearer and easier to follow. Now, think about the same person deciding to quit smoking. Suddenly, there is no more nicotine giving that good feeling. At first, the brain has to adjust because it is used to getting that pleasure from smoking, and it's like brain pathways related to smoking become a bit weaker because obviously the person does not reinforce that behavior or has stopped smoking. So these pathways underlying smoking behavior gets weaker and weaker and weaker, and hopefully at some point it gets completely diminished. However, this change might lead to a certain level of irritability and anxiety. So whenever we want to change a behavior, it comes with some emotional responses. It's not that easy, and obviously it takes time. So now that you learned what long-term potentiation and long-term depression are, let's discuss how CBT helps. The basic promise is that our thoughts influence our emotions, and in turn, our emotions can impact our actions. This interconnected relationship is often referred to as cognitive triad. The way we interpret events, situations, or ourselves can lead to specific emotional responses. For example, if someone consistently interprets situations, or in context of misophonia, sounds in a negative or catastrophic way, which is known as cognitive distortion, it can contribute to the experience of negative emotions such as anxiety, anger, sadness, or disgust. We have seen this pattern of actually attitude of thought in people suffering from misophonia when you look at different research studies, that they always report this internal dialogue that they have with themselves, that why the person is doing this, why the person is making that sound, the person is making that sound purposefully to bother me, that person is making that sound on purpose, so drives me crazy. Emotions have a direct impact on our behavior, and the way we feel influence the choices we make and the actions we take. For instance, someone experiencing intense anxiety might engage in avoidance behavior. In context of misophonia, you hear the sound, you interpret the sounds the way that, for example, I brought the example for, and then you feel anxious, you feel super angry, and it leads to escape from that situation with the sound trigger in it. Alternatively, a person feeling sad may withdraw from social activities or isolate themselves. So, in the grand scheme of things, cognitive behavioral therapy aims to break this vicious circle by changing and reconstructing our cognition. The very first step, that attitude and that internal dialogue, and the way that we perceive and we interpret different events, or in context of misophonia, sounds. The idea is that when cognition changes, it will affect our emotions and subsequently our actions. So I would like to make an example of, after explaining all this, this is a very important part, that obviously during CBT, people learn several different techniques to reframe or reconstruct this attitude or thoughts. But I want to tell you exactly what happens in the brain when you change all this. One of the techniques that people normally use or people normally learn in CBT is exposure with response inhibition. This technique is widely used in different affective disorders such as obsessive compulsive disorder, or different phobias like arachnophobia or excessive fear of spider. So response inhibition refers to the ability to control or manage your reactions when you hear certain triggering sounds. It's like having a mental break that helps you stop or adjust your immediate emotional response to those bothersome noises. Imagine someone nearby is making a sound that usually drives you crazy, like chewing loudly or tapping a pen. Response inhibition is a skill that allows you to hold back the strong emotional reaction you might typically have, and instead instead of getting instantly anxious or angry, you can use this mental break to pause, take a moment, and choose a more measured or calm response. So response inhibition in the world of misophonia is like having a control switch for your immediate emotional reaction to those irritating sounds. It does not make the sound go away, but it empowers you to manage your emotional response more effectively. If someone practices response inhibition for an extended period, let's say 2 months, 6 months, or 1 year, it depends on the person, age group, and so on, meaning they consciously restrain anger when exposed to the misophonic sound. The connections between the neurons responsible for those response, like anger, undergo long-term depression. So the less you react with anger to misophonic sounds, the more you're likely to experience calmness or experience less anger. Basically, you try to, by inhibiting your response, you try to change your brain. So your brain pathway, or the pathway that is associated with anger response, gets diminished after a while. So as a conclusion, through various techniques, CBT can help misophonia sufferers by altering the function and the structure of the brain. Consistency and repetition play a crucial role, with behavior changes typically observed between 18 to 225 days, averaging around 66 days. So I would like to put an emphasis. If you want your CBT to be successful, you have to be consistent and you have to keep repeating all the techniques that you learn from your psychologist. Because if we want our behaviors, if we want our emotions, thoughts, and everything that's manifest from us to change, we have to take some time. We have to let our brain to reshape. CBT stands out as the most effective psychotherapy for addressing a broad spectrum of mental health issues and psychiatric disorders. I would like to wrap up my presentation and webinar today with saying that if you or a loved one is struggling with misophonia, clinicians and healthcare professionals extend their support at Hashir International Specialist Clinic. Hashir Clinic is dedicated to providing professional assistance to individuals dealing with misophonia, grounded in a wealth of clinical observation spanning over a decade. Additionally, Hashir Clinic invites your interest in exploring their CBT course. Feel free to reach out and let them guide you toward effective solutions for misophonia. Thank you.
Wow. I mean, that was so fascinating. I think perhaps for me, because there's so much there I can relate to, I wrote down so many questions that I wanted to ask, because
so
much of it just fascinating. I mean, when, as part of the treatment program that I did, we had a conversation, didn't we, where you kind of laid down a lot of the foundations of this science, you know, as part of understanding it, that contributing to the treatment program, and really understanding the science can be so helpful while you're learning the techniques. But so much of it there, yeah, very relatable, and just fascinating. You know, your comparisons to the muscle memory and those pathways going from kind of trodden, and just, I mean, one thing that you mentioned was, I've written it down here so I don't get it wrong, but the less we express the anger response, the more it can be diminished, which is fascinating, because I guess if you're not giving your brain, what I've written down, by avoiding sounds, you're not giving your brain the chance to become diminished. Is that an accurate way of putting it? I mean, it's something I'll maybe touch on at the end, and we can come back to it with the questions. So to respond to your kind of presentation as someone who has completed the CBT program, one element of it, like I say, is recognizing the moments where you are avoiding those trigger sounds. And as you say, they're known as avoidance behaviors. From my perspective, you know, I think a lot of those with misophonia can relate to an avoidance behavior, such as leaving the dinner table, getting out of the room when someone's eating, or coughing, but also more kind of broader ones like wearing headphones when you don't necessarily need to. So having white noise apps, music playing in your headphones whenever you're around other people. It's, you know, it's avoidance behavior to avoid hearing those sounds. It certainly was for me. One thing that I would do like clockwork when I woke up was to put on a podcast or a radio. It was something I was doing so routinely. It was a habit. I wasn't doing it to listen to the words for entertainment. It was very much just part of my day to day. I just wanted the background noise to make sure that I didn't hear anyone else. And when I did the CBT treatment, identifying these avoidance behaviors was a really important part of it. And from what I learned, you identify them, you list those behaviors, and then you very gradually reduce them, kind of very slowly, very step by step. So you make a plan with your therapist. So one week you might say, okay, for one day I'm going to eat breakfast with my family, or for me this week I'm going to go 2 mornings without immediately turning on that podcast or that radio, or I'm going to wait for 30 minutes before I do that. And so you try this, you kind of take these steps and you keep checking in with your therapist throughout the process. You talk about how you feel it's going to go, how you think or anticipate that you'll feel during that lack of avoidance, and you notice how you feel during it, and you talk about afterwards on reflection, was it as angering, as difficult as you thought it would be? Kind of checking in with how your brain reacts, what thoughts are coming up, what might be different now than when you started. And it can certainly be a daunting experience to put yourself in a situation that you're so used to avoiding. I remember being very daunted by it and, dreading some of that. But like you pointed out, Mercede, knowing that consistency and really kind of dedicating yourself to that can contribute to a really effective kind of way of managing it. But, each time I spoke with my therapist afterwards and how it went, what thoughts were going on, it was never as bad as I anticipated it would be. In my head, eating breakfast with other people was guaranteed to be angering and, disgusting and really difficult. But each time I discussed it afterwards, it was actually more manageable than I predicted. And that increased, that kind of difference in expectation increased as I kind of went further into the program. And you do check in throughout the CBT program. So it kind of gives you a scale, which I guess is a scale of how much your brain is perhaps changing, like you pointed out, during that treatment. It gives you something to compare to during, from before treatment. And then, from my position now, a couple of years, even after completing it, finishing it, I can still look back on the notes that I made and see that significant change, not only in my day-to-day experience, but, that is a significant change in my brain and how it functions. So I guess coming back to what I mentioned, I found so fascinating. How does kind of what I experienced relate to what you described for us in terms of being exposed to more trigger sounds and how CBT worked during that lack of avoidance? Could you explain that for me a bit further?
Yeah, I'm not. I would like you to reword your question.
Mm-hmm.
I'm not really sure if I follow exactly what you mean.
So I guess, is it correct to say that by avoiding sounds, we're not allowing our brain to become more tolerant, or it's not getting the opportunity to express anger, but then it's also, so it can't become less diminished because we're not in that situation at all? How does avoidance behaviors work in relation to CBT?
Okay. If you remember in a previous webinar, I was talking about the brain basis of misophonia, that there are reasons why people with misophonia experience all these responses. And one of the we call it neural signature, or the brain signature of misophonia, was the overconnection between different parts of the brain. And one of those parts of the brain that contributes a lot to the especially emotional responses is amygdala. So imagine yourself that every single time you hear one of these triggering sounds, anterior insular cortex, that is responsible for emotional processing and also for saliency, grabs that sound, sends signals to amygdala. Amygdala creates that negative emotion. Okay. And
Mhm.
because of that emotion, you act on it. You act on anger. Okay. Now imagine that after your CBT, you learn all these basically techniques. One of them is to encountering with the sounds and avoidance behavior. So the more you act on it, the more you strengthened the connection between anterior insular cortex
Mm,
or frontal areas to amygdala.
mm,
Every time you start misinterpreting the sound or that cognitive distortion I was talking about, perceive negatively, emotion, action, negative
mm,
emotion, action. But if you start reframing all these thoughts and do not, or sometimes you, of course, do experience these emotions, but do not act on it,
mm,
this pathway, this over connection will diminish after a while.
mhm.
Make sense?
Yeah, that's
But like
fascinating.
I said, it takes time. You
Yeah.
have to be consistent. You can do the point is inconsistency in these techniques will only prolong the improve the misophonia responses. So
Mm,
some people might say, "Yeah, I've been doing CBT literally for 6 years. It hasn't have any effect on my symptoms, but because they do it on and off. They do it one
mhm,
week, they don't do it on the other week. They would say, for example, I'm going on a trip, so I will put on my noise canceling, but I will start from next week. This will only prolong the responses, and it might come with some consequences like frustration or untrusting the treatment and healthcare,
mm,
everything.
mm. Yeah, I can certainly relate to that in terms of consistency being so important. When I had periods of inconsistency, I would then see the kind of effects of that and obviously feel the effects of that next time I checked in. And then the opposite was definitely true in that when I had a period of time when I was really consistent, I would, yeah, feel much more able to manage things, which was a fantastic feeling. So yeah, I can certainly agree with that. Now, unfortunately, it looks like on the video, the comments are disabled. So apologies for that confusion. What I have said instead is to put them into the chat. So I'll just give a couple, just 30 seconds if someone who is watching has a video. Since we're streaming on YouTube, pardon me, there is a slight delay. So we'll just give it 30 seconds. And while we wait, Mercedes, did you have any questions, I guess, in response based on my experience I described?
Yeah, something that I have been asked many times, that does CBT help us not pay attention to the sounds anymore?
Mm, mm,
Or the CBT only helps us to manage the emotions?
mm. Um, so I would say from my personal experience, yes, it certainly helps to not notice the sounds in the first place. Which I found there was a moment that I kind of realized this, which was there was a trigger sound for me, which was a very regular sound. It was a construction sound nearby. And I hadn't it kind of came up in conversation with my partner, and I thought, and I said, and I kind of said, "Oh, it must be broken. You know, this bit of machinery that was making a noise. Oh, it must be broken. I haven't heard that in weeks." And my partner was like, "Oh no, that's it's still been going." And it was this kind of amazing moment where I realized, yeah, it had been happening as regularly as ever, but for me, it had stayed in the background. I hadn't focused in on it. And I guess I had experienced that noise in the same way that someone without misophonia would have experienced it. It was just a noise that faded away, and I didn't notice it. So, yeah, I can certainly say that that was something I experienced from my own personal experience.
Okay, cool. Yeah, very interesting. But I would like to add something to it. If there is no comment
Not at the
or
moment, no.
question,
But yeah, go on.
all right. We have to basically distinguish between the common misophonic triggers and universally unpleasant sounds. The
Mm.
example just made could be also considered as universally unpleasant sounds. We know that no matter what culture or what background or what age group or what gender you have come from or you have, there is the high chance that majority of people, regardless of all those demographic characteristic, respond negatively to, as an example, mechanical sounds, because there are some specific, a certain psychoacoustic profile or properties into those sounds that the human brain seem to perceive them negatively. One
Mm.
of them, for example, loudness, or that is basically measured in volume, measured in dB, I would say, but volume is a common term that we refer to loudness a lot. We know that sounds, for example, above 85 decibel is actually very damaging to our health. We know that people living in big cities with a lot of loud sounds around them are at higher risk of developing all sorts of physical and mental issues. And at the same time, it does damage our peripheral auditory system. So we are not talking about those. Those sounds are unpleasant to a lot of people because of those psychoacoustic profiles I was talking
Mm.
about. But misophonic sounds are different because misophonic sounds are pretty innocuous, possibly environmental and non-environmental human-generated sounds that do not necessarily damage or do not necessarily hurt our physical and mental health.
Mm. Yeah, no, that makes a lot of sense. And I think, yeah, it's, it's each person's, pardon me, personal kind of, I guess, realization of, as you say, is this considered a general noise that people without misophonia would not find pleasant? And yeah, that's a big part of identifying those trigger sounds at the very start of the CBT treatment, really realizing, kind of digging into what those sounds are, whether they're common ones or less common, and kind of each person will be different in that way. But yeah, that is a very important note to make.
Yeah,
So,
but I said this because some people might get frustrated after finishing the CBT sessions. They still might be sensitive to those
hmm,
environmental sounds, but these environmental sounds tend to sort of elicit our sensitivity because, like I said, because of the physical properties that they have. So it is okay because everybody might react to those sounds
yeah, that makes
like
sense.
that.
Wonderful. Well, let me have one final check. We are always open to questions and comments on our social media sites. If going away, you have a think about what we've discussed today and you want to get in touch, obviously there's our formal website, an email address, but we also have a very active Instagram account where we have great conversations with the people that follow us there. And we will be doing this next month. And if there's a topic that you have a particular interest in that you'd like to suggest, do let us know. Anything to add, Mercede, before we sign off?
No, thank you very much for organizing this, and also thank you. Thanks, a big fat thanks to all our audience, and hopefully we will get some feedback in on YouTube. And I would like to hear more from them.
Yeah, wonderful. Okay, thank you so much, everyone. We'll see you next month. Goodbye.